G'day, I'm going to talk to you about my fiancée Richelle Lincoln's fight with acute myeloid leukemia and what we had to do to get her through and into remission. June 2012, Richelle went into Gosford Hospital with severe morning sickness. Had very severe morning sickness for the past 3-4 days. Apparently only 1% of women in the world get this type of morning sickness, and Richelle happened to fall into that category. Through the testing processes that they were doing at the Gosford Hospital, they found that Richelle had leukemia, acute myeloid leukemia. This meant that Richelle was then going to spend the next 3 months in hospital having chemo. From that point on, there was no going home, no nothing. It was a process where we almost lost her twice, ups and downs as there will be. But the one thing that kept us going was the hope of having children once we got her into remission. Mind you, once someone is in remission with leukemia, for example, doctors don't like you to fall pregnant straight away. Males, it's a bit different. But it at least takes 6 months for the reproductive system, male or female, to start reproducing sperm or eggs properly anyway. Richelle's in the category of she may relapse. 75% of people in her category relapse within 24 months, 2 years. So we've been advised not to have children for the next 2 years, and we can't test her fertility. We shouldn't test her fertility for at least 6 months to give her reproductive system a chance to recover from the 3 rounds of chemo. Richelle was lucky enough to have great nurses and the specialist of haematology, Dr. Campbell Tiley, up at Gosford Cancer Ward, save her life. The nurses up there were great. The hospital had great support. The one thing that there wasn't was information and help on what people do and have to go through for fertility and to start a family after cancer. Whether it be pancreatic cancer, bone cancer, leukemia, which Richelle has leukemia, AML cancer of the blood. There's all different types of cancers out there, and one thing that no one has thought of bringing up yet is the fertility and the storage of people's fertility before they have to go through such invasive processes such as chemo or radiation. These things can do terrible things to the body, as I've witnessed. Makes you lose your hair, and with chemo you lose your hair, you have ulcers, you get a whole range of things that you'd never wish upon your worst enemy, let alone watching a loved one go through it. It's the most horrendous thing I've ever had to sit there and be helpless and not be able to do anything for. The good thing that has come out of our little angel's termination is that it has given Richelle and I the motivation to start a foundation where we can help other people who will be put in the same situation as what we were. We didn't unfortunately have the chance before Richelle started chemo to have eggs frozen, and with males it would be sperm frozen, but what we are now wanting to do is start a foundation called Richelle Clark Kids After Cancer Foundation. This foundation will have doctors, nurses, lawyers involved, but the main goal of it will be to help people have the information and the knowledge of what will happen to their body throughout the course of their chemo, how different chemos affect different people differently, how long the waiting processes are before you can start to have children, try to have children, have eggs frozen, sperm frozen. These are all things which the information is not readily available in a pamphlet like it is for say, Look Good, Feel Good, or Breast Cancer Foundation. the one thing about our foundation is it doesn't target just one type of cancer. You know, it's not just for leukemia patients or anything. It's for anyone in the age bracket of, I'd say, 16 through to their mid to late 30s, even into their 40s, wanting to keep their fertility alive, and have their eggs frozen until they find out whether they actually are fertile after their chemo treatment, or whether they have to have surrogates, donors. All these kinds of things will be things people have to think about once they have finished their chemo, their radiation, whatever kind of treatment they're having, to find out where they will be able to, when they will be able to have a family, how long it's going to take. All of this is very frustrating to try and find out. So what we want to do is make it easier for people to find out this information, and have a national centre where people can just go to and contact.